Hi, I'm Dr. Mitch Danilovic. I am a chiropractor at Activ Therapy Gladesville. Chiropractors mainly focus on the spine and the health and function of the spine. What we look at is how the spine moves, how it actually is structurally, so like your posture, and we're trying to prevent future aches and pains of the spine. Chiropractors do also focus on other injuries and issues in your body, anywhere from your neck, back, lower back, arm issues, shoulder, elbow, ankle, knee. So we do a variety of things, but again, our main focus usually is, and we see the most people with their back problems, neck problems, shoulder problems, and so on. I became a chiropractor because when I was finishing high school, I was deciding what I wanted to do, and I have a helping nature, so I like helping people, but I actually had an issue myself, and I saw a few different practitioners, helped temporarily, but one of my friends, she was like, actually come to the student clinic, let's have a look how we can help you. When they got better after the first adjustment, it really opened my eyes into how chiro can help. After that was it. I made sure that down the track I want to become a chiro. So it was a really good experience. I am the go-to amongst friends and family. I usually end up adjusting everyone, like gatherings at parties and so on. I love doing it, but I have learned my lesson and I've actually stopped telling people that I am a chiro. So my approach to being a chiropractor when I treat people is I actually treat the person and I work with the person, make it a personal approach to get the long-term results that they need. So I look at them holistically, which I look at the injury, but then I also look at why the injury came about. So we have to find the cause, which is the key thing there, why they have the injury in the first place, or the aches and pains. And then we look into how we can actually fix all of that and what exercises we need to do and how we actually work together to overcome the issue. More and more people are working from home. This is becoming the new norm, but it does present us with a few issues because there's a lot more sedentary lifestyles, more repetitive strains on our bodies. And also the setup at home tends to be different sometimes to the office, especially ergonomically, which means that we are sometimes sitting on the floor, sitting on the couch, sitting on a stool or a chair, and that actually leads to extra stress on the body and an extra strain on the body, which ultimately then leads to aches and pains. What happens to our bodies as we sit and move less over time is we get more wear and tear. The tissues and the structures and the muscles and ligaments, they all have a repetitive strain on them, and when they get to a certain level, or what we call a threshold or the breaking point, things start to break down, that turns into aches and pains that you get, and over time most people will know they'll get tightness and aches and pains, but then it leads to a bit more of an ache and a bit more of a pain before they actually decide, okay, something's up, I need to go see someone. Preventive care is very important because we get on top of an issue before it turns permanent, so before there's a permanent change. Literally what I tell most of my patients is prevention is better than cure, because we can get on top of a problem before it becomes too serious. Chiropractic care is backed by science. It's been around for a long time. There's a lot more research and evidence coming out to support the benefits of chiropractic. We're seeing a lot more improved techniques. We're seeing a lot more improved approaches based on the research that's come out. Overall, it's getting a lot more recognized with mainstream medicine. Some people may think that seeing a chiropractor can be a bit scary, but most people walk out feeling a lot better. Our aim is to actually help you and help you get a lot better, and that's what we're trying to do. And most people, once they try it, they keep coming back. I opened Activ Therapy in Gladesville because I've been living there for quite some time now, and I love the area, I love the community. I've studied down the road at Macquarie University, and the area is a really nice family-oriented area, and I've got lots of friends and family that you used to treat. It was a bit harder for them to travel to other places where I work. So I thought, what better than to actually look in opening right there. It's easier access to everyone, and it helps all my friends and family and the community at the same time. The advice that I would give to people that have not seen a chiropractor is come and experience it for yourself. It might actually help you and change how you see things, and it might actually help you get rid of those problems that you might have. There is a lot of people that haven't seen a chiropractor, but it's not that scary, it's not painful at all. what people do is once they do see a chiropractor, they end up sticking to them for life. I recommend you give me a call and organize a free consultation. You can book it online as well, and I look forward to meeting you all.